Hi, I'm Wakefield from Stop the War Coalition, and I want to talk to you a little bit today about how the COVID-19 crisis has shown more than ever that we need to be disinvesting in the war machine and investing the funds that we could retrieve from foreign wars and redirecting them into our health services, which have induced such a feeling of love and support from everyone in the country. And I'd like to start with one particular example, which highlights the warped priorities of our government, and particularly during this crisis, how much they've been thrown into the light by the current crisis. So in April of this year, right at the end of April, during some of the very worst weeks of this crisis, our government, for the first time in 18 months, sent drone missions to bomb people in caves in Iraq. These airstrikes were carried out with very little scrutiny, no approval of Parliament, and were also carried out while Boris Johnson was recovering in hospital from coronavirus. So there was very little scrutiny of this activity, and it was disturbing, to say the least, that our government was willing to send drone missions to one of the poorest and most war-torn countries on earth. Meanwhile, we couldn't guarantee basic personal protective equipment for some of our doctors and nurses. Now, each drone mission, in which it takes 2 Tornado helicopters to fly there, costs approximately £1 million. According to the organisation Drone Wars, which does fantastic work highlighting the role that drones play in modern British warfare, the RAF flew 2,464 such missions between August 2014 and December 2019. The estimated total cost of all these missions then, over that almost 5-year period, was close to £2.5 billion. Now, this raises the question of how that £2.5 billion spent pounding war-torn countries in the Middle East with high-tech missiles could have been much better spent preparing the UK for a global pandemic. It's not as if our government or the Ministry of Defence were unaware of the risk of such an outbreak. In 2014, a Ministry of Defence report titled Global Strategic Trends Out to 2045 stated that the likelihood of disease outbreak could be mitigated by alertness to changing trends in infectious diseases. Now, no such investment really took place, and the country was caught very much off guard by the pandemic. Meanwhile, our defence budget has seen continued increases over almost 20-year period, but particularly during the last 10 years of Conservative government. We have the 6th biggest defence budget in the world, and it's set to be increased to £55 billion this year. It's the 4th largest area of government spending, and 5p in every pound of taxation goes towards the military. It's also equivalent to 1/3 of total health spending. Now, at the same time this drone strike was taking place, the BMA, the British Medical Association, warned that the NHS is in crisis. Pensions pay and capital funding have left the health service close to collapse. It urged the government to implement an urgent package of measures to increase investment. Now, this is also coupled with a long-term neglect of our public health services. In Rishi Sunak's first budget in March of this year, he pledged £145 million to our public health services. Now, that may sound like a lot, but for a continued period now, the Faculty of Public Health have called for a £1 billion increase in the public health budget. So Sunak's increase was less than 15% of the amount these bodies were demanding. These are the bodies that their main focus is to deal or foresee and put in measures in place in order to counteract pandemics and viruses such as the one that we've seen devastate the country over the last few months. Now, what does all this have to do with the bombing of Syria and Iraq? You may ask. Well, it's a simple question of priorities. That £2.5 billion spent on tornado missions over those past 5 years could have made up half the deficit that our public health bodies were requesting. Nothing has highlighted the outrageous level of military spending that the British government does more than this current coronavirus crisis, which no bomb, gun, tank, or for that matter nuclear missile could do anything about. Quite simply, war is a non-essential activity and one the world could do without. This has been made more evident than ever during the coronavirus crisis. If there's one clear lesson we must learn from this pandemic, it's that protecting people requires investing in medical facilities and equipment and not military equipment. Quite simply, we need to cut war and not healthcare. Thank you.